Let's talk about the role diastasis recti plays during pregnancy. Oftentimes when we're talking about diastasis recti, we're talking about it in a context of something that needs to be addressed, healed, and fixed, because usually it's something that is causing symptoms and issues. But there is actually a specific role that diastasis recti plays during pregnancy that is really good to understand so you don't fear it going into or immediately after pregnancy. Anatomy-wise, our rectus muscles are naturally separated into two halves. You have the left rectus and the right rectus. They are held together by connective tissue. Now, when the core is strong, when it's functional, that connective tissue is firm, the muscles are close in proximity, and there is good function and tension and activation. Now, once you get into the latter end of pregnancy, usually during third trimester, the body is needing to continue to accommodate growing babe, because at this point, baby is getting bigger. Now, what the body does naturally is the rectus muscles separate. The connective tissue thins, the rectus muscles move apart to allow baby to continue to grow. Diastasis recti is actually a very natural part of pregnancy. So diastasis recti is not something that you need to fear during a pregnancy. It's not something that you need to try to prevent completely. It's not something that if you already had a previous diastasis from another pregnancy that you need to worry about completely healing during a subsequent pregnancy. So the role of restorative movement and exercise and MUTU system during a pregnancy is not that you're trying to heal. You're not trying to fix the diastasis or prevent it during your pregnancy. What you're trying to do with MUTU during your pregnancy is continue to stay, number one, that mind to muscle connection, staying connected to your core and to your pelvic floor during the pregnancy process. It will help you during labor and delivery. It's going to help you afterwards with postpartum healing to still have that connection to those crucial parts of our bodies. And also doing this restorative movement during doing the core and the pelvic floor exercises, it's going to help keep your muscles in better condition, keep them stronger, keep them more active and more functional. So when it comes to postpartum healing, you're starting off from a better place than you were if you had done nothing. Your core and pelvic floor takes an incredible load during pregnancy as your body's growing a baby. And to continue to stay active and work those muscles, you're gonna help support the process of growing a baby inside of your body and to hopefully avoid, worse symptoms postpartum and lingering symptoms postpartum. Statistics say that 100% of women will have some level of diastasis come the third trimester of pregnancy. Now, the reason why you don't have every single woman struggling with diastasis postpartum is because just like diastasis is a natural part of pregnancy, the healing of diastasis is also a natural part of the healing postpartum. So the body is meant to heal and close that separation. So the problem comes when there is essentially barriers to the body being able to heal the diastasis recti. So that comes from our alignment, it comes from our breathing patterns, it comes from our recruitment and our core function. If we weren't able to really maintain that during pregnancy and also before pregnancy, if we weren't connected to those muscles at all, and other factors as well, genetics when it comes to connective tissue, these all play a role in if our body is able to heal naturally. That separation about 8 to 12 weeks postpartum is that kind of that natural healing window frame and a little bit beyond as well. But when women struggle with diastasis that's not healing, that's not closing, there's symptoms, leaking, pain, the poochy tummy, all of these issues that remain for months to years postpartum, that is when you really need to focus on actively healing diastasis recti postpartum, because that's when it does become more of an issue that does need to be addressed. So if you are currently pregnant right now, changing your mindset around diastasis, taking that fear-based approach away is going to benefit you so much. Diastasis is a natural part of pregnancy. It is normal to have a level of separation immediately postpartum. So if you are told by your practitioner, maybe at a checkup during pregnancy that you have a diastasis or more immediately postpartum, don't let that stress you out. There are so many women who get really worked up because they were told they had a really large diastasis during their very first checkup postpartum a few days after giving birth, and it starts to worry them. And that is something that is okay. Your body has an incredible amount of healing to do, and your body is incredible at supporting and healing itself. So do not stress if you are pregnant or newly postpartum and you have a diastasis. There is things that can be done. MUTU is here to support you, but understanding the role of diastasis during this process will empower you and to remove the fear around it.